This is our webinar on dealing with difficult thoughts. My name is Tim Gruber, and I'm with Modern Health. And Modern Health offers comprehensive mental health benefits to companies that we work with and to their employees. However, given the current state of affairs in which we find ourselves, Modern Health is offering these free community sessions on a variety of topics today, dealing with difficult thoughts. A couple quick notes before we get started. The first is that microphones have been muted. However, please utilize the chat feature and the question and answer feature throughout the session. I'll be watching that and then can ask any of those questions to Dr. Simon. Second thing is that this session is being recorded and it will be sent out to everyone at the conclusion of the session. So if you want to refer back to the session or if you just need the session and want to hear what Dr. Simon has shared again at a later point, that is available for your use at the conclusion. We are so fortunate to have Dr. Erica Simon joining us today. I'm going to turn it on over to her. Dr. Simon.
Thank you so much, and welcome everyone. Thank you for joining. So my name is Erica Simon. I'm a licensed clinical psychologist, and I have specialties in adjustment, anxiety, stress, trauma, and health-related concerns. And then I also have training in evidence-based techniques to address those concerns. A disclaimer that we have before every session is the content in this webinar is provided for educational purposes only. It is not intended to be a substitute for professional advice, diagnosis, or treatment. Please contact your healthcare provider for clinical needs and never disregard professional mental health advice or delay in seeking it because of something you heard in this webinar. All right, so the overview, we're going to be talking about common reactions to stressful situations. And then we're going to be talking about the cognitive triad, which is a way to understand our reactions to stressful situations, ways to challenge our cognitions, to change our behaviors, and to impact emotions. As Tim said, definitely want this to be interactive. I'll be stopping to ask questions, but using the chat and the question and answer feature to ask your questions throughout. And Tim, please feel free to interject if some questions come up that I would like to, or that would be good for me to answer. So right now we are experiencing what someone has described as a collective traumatic event. It's a really scary, stressful time with a lot of uncertainty. And we're all trying to do things like we're home, trying to deal with this crisis and do things like parent and work. So what we're going to be talking about are some common reactions to stressful events that are emotional, the behavioral, the physical, and the cognitive ways that we respond, and going through those in detail. So when we're having stressful experiences, what that does, it taps into our threat detection system. And our threat detection system is built on trying to detect physical threat. So is there a saber-toothed tiger over there? And what that does is it activates this fight or flight response where we are going to either immediately fight or flee this thing that's dangerous in our immediate environment. When we're dealing with something like psychological stress, it's different because we have this threat that's not quite right here necessarily, but it might feel like it's lurking around the corner. And because of this, it taps into that same threat detection system. And so we're going to have the same kinds of responses with both. Some of the emotions you are probably pretty aware that you're feeling are anxiety, fear, but you might also be feeling really angry or withdrawn, or like you really can't find any enjoyment in the things that you usually enjoy. You might be feeling empty or hopeless. There might even be some sense of numbness or shock. And then you might be engaging in certain behaviors like fighting with your family members or being really overprotective with them. You might be turning to substances to try to cope, or maybe you're keeping yourself excessively busy so you don't have to think about what's happening. You might be isolating yourself more, even beyond what is being asked of us from a social distancing perspective. And then the thoughts, you might find that you're having difficulty concentrating or following instructions. You might even feel like you're starting to have memory problems because it's so hard to think and concentrate. You might be having very strong memories of events that have happened. There might be self-blame or other blame. And then you might be feeling a lot of physical symptoms. You might be really tired and lethargic right now. You might find you have headaches that just kind of don't go away. There might be a lot of more tension in your body. You might be experiencing pain you've never experienced before. You might notice that your heart rate is basically consistently always elevated. You might notice some changes in your breathing. These are all really normal responses because, again, our bodies are activating that threat detection system, that fight or flight response. And it's in response to a lot of psychological stress. And then that's just mixed in with the crisis that's happening, that's unfolding. So it's really normal to have these experiences. So I want to take a moment to pause and see, are you finding that some of these experiences that we're discussing are resonating with you, of how you're feeling right now?
Dr. Simon, I'm seeing some responses here in the chat feature talking about difficulty with focusing on work, difficulty with staying on task and feeling like we're distracted by their thoughts throughout the day. Also feeling a bit of anxiety and fear over the future as plans are up in the air and constantly changing.
Yes, I think those are all really reasonable responses and things to be feeling right now. So what's important to note about, so the person who said that you're having difficulty concentrating, that's a really understandable response, and this is why. So if there's, again, we're tapping into that physical threat detection system. Is there a tiger over there that's going to eat me? And if you're having to respond to a tiger over there that might, cause you harm, it's not adaptive to be thinking about, well, what should I do? Should I do this or should I do that? Our bodies are programmed to automatically and immediately jump into action to either fight or flee. And during that time, our brains kind of go offline. Our thoughts actually aren't going to be helpful. Trying to think through the problem is not going to be helpful. And so our brains go offline. And that same experience can happen when we're experiencing ongoing psychological stressors like what's happening right now. So you are going to have a harder time focusing. You are going to have a more difficult time concentrating. This is actually makes perfect sense from a physiological perspective. We're going to be talking about addressing some of those thoughts that keep on going through your head that feel distracting, the worries. We're going to be going through some techniques and skills to help you with those. And then stress management techniques are really important to make sure you're doing so that you can help dampen down some of that activation that you're feeling. That can help with some of that focus. And then for the person who's talking about the uncertainty, again, it's very realistic that you're concerned about the uncertainty. As humans, we crave certainty, predictability. We want to know what's going to happen. We want to know what's going on. And right now, there is just a lot of uncertainty, things that we do not know. It is important to keep in mind that at some point we will be on the other side of this. And until we are, we're going to have to just keep on moving through it. So noticing that uncertainty, recognizing that it's realistic to be concerned about what's going on, and then using some of the skills and strategies that we'll talk about.
Dr. Simon, we touched upon right there some common emotional reactions, some common thoughts that we might be having, but also I'm seeing in the chat that also mixed in there is having some headaches throughout this time, and that touches more upon one of those physical reactions that you mentioned.
Exactly. So right now, with the stress response that you're experiencing, what happens is when your body is in immediate threat from some sort of physical danger, the whole cascade of changes happen in your body physiologically. So your respiration increases because you need to take in more oxygen because you're going to be doing something that's active. It's kind of like when you're exercising, you need to take in more oxygen to meet that metabolic demand of exercising. You're going to have, blood is going to be, less blood reaches your head actually, because again, it's trying to take your brain a little bit offline. More blood's going to be going to different parts of your body when you're dealing with that immediate threat. So that's how that works. But when we're under this constant stress that doesn't go away, there's no clear end to it. And what's going to happen is you're still going to be having a lot of these physiological reactions. And that tension that you feel, this tensing up, this sort of activation of your physiology to try and handle the danger, what that does is that increases physical tension, and that can contribute to headaches as well. You might not be sleeping very well. A lot of people are struggling with sleep, and so that's going to contribute to headache. So there's multiple ways that headaches can be a common problem right now. So just trying to note that if you are struggling with headaches, a really powerful coping skill can be to try to do a breathing exercise. And actually, if everybody wants to try this out, we often start with one of these exercises. So just closing your eyes and sitting comfortably and putting one hand on your chest and one hand on your abdomen. And then just taking a couple of breaths and noticing where the breath is. Is it in your chest or is it in your abdomen? And then seeing if it is in your chest, see if you can pull that breath down to your abdomen on the next couple of breaths. And you want to breathe very gently and slowly, not trying to force it in any way, but breathing in and out gently, like a wave sliding in and sliding out on the sand. Just gently and slowly, and with your abdomen breathing in and breathing out. And see if on the next couple of exhales, you can extend those exhales just a little bit. Again, you don't want to force it, but the goal is to just slow the breathing with the diaphragm, and then seeing if those exhales can be just a little bit longer each time. Maybe taking a couple more breaths. And whenever you're ready, opening your eyes. Okay, so what did anybody notice about that experience? How you felt, what you were feeling emotionally or physically?
Dr. Simon, I'm seeing some folks type here in the chat that feeling like it's Friday and the end of the week, and maybe just a sense of finality that, all right, it's the end of the week here.
You can relax a little bit. Yes. Okay. So it sounds like just taking that moment to focus on your breathing actually allowed you to have a positive experience of feeling that TGIF kind of feeling that might be a little bit lost right now because of everything that's going on. That's awesome. Does anybody feel just a little bit more relaxed, a little bit like their body feels a little bit more settled?
Dr. Simon, I'm seeing some comments about feeling still, feeling much more calm than before, feeling concentration on the breath.
Awesome. Yeah, so these are all great comments. And I think this is really important because respiration is the only part of our physiology over which we have voluntary control. And our breathing connects to literally everything in our bodies. It is by breathing with our chests and breathing erratically, and that what that does is signal to our brains that we are in a really stressful situation. And by slowing down the breathing and breathing it down to the diaphragm, to the abdomen, slowing it and extending the exhales. So when we're breathing relaxed in a relaxed state, our exhales are about twice as long as our inhales. So just bringing ourselves back to that state of calm breathing, what that does is it literally dampens down that stress response. Literally, it taps into our what's called our autonomic nervous system, and it helps put the brakes on the part that's the fight or flight response, and it helps to push us over into pulling up that relaxation response. So tap in with yourself across the day. Put some reminders in your phone to check your breathing, and just do this quick little breathing exercise across the day. And I can pretty much almost guarantee that what that will start to do is help you to not only feel that sense of reduced stress, but it's a great way to, if you're feeling distracted, to increase that focus. And it only takes 30 seconds to a minute to get an effect already on that focus. So I highly encourage you to integrate this into your daily routine. So thank you for all those comments. So someone mentioned about the thoughts that are going through your head. And there are probably a lot of thoughts that you're really well aware of that are going through your mind right now. And then there are probably some thoughts that are deeper thoughts that you're not even aware that you're having. And that's normal. That's how our human minds work. We have thoughts that are racing through our heads. We don't even realize it. Our brains are thinking brains, and that's okay. That's a really cool part of being human, is we can think these thoughts. The problem is when our thoughts really, sweep us away and take us on a ride. So this is called the cognitive triangle in cognitive behavioral therapy. And it's a really simple schema for understanding how our thoughts and our behaviors and our emotions are all interlinked. So as just a quick example, if you are sleeping and you get woken up in the middle of the night by a loud noise and your thought is, that darn cat, what emotion are you going to feel and what behavior are you probably going to engage in? And anybody want to guess? Or say what they would do? What would you do if you were woken up and thought was that darn cat?
Dr. Simon, I've got some responses here talking about feelings of being alarmed and feelings of some frustration of like, what's going on with this cat?
Yeah, what is going on? What is going on with this darn cat? Yeah, so frustration, or you might actually be feeling a little bit more scared just because right now you're feeling a little bit more activated. And then your behavior might be to go to sleep or go and pick up the other thing, back to sleep, or pick up the thing that was knocked over. And then the same thing. So you have a loud noise wakes you up and your interpretation or your thought is, there must be somebody in the house. If that's the case, you're probably going to feel scared and you're going to grab a bat and call 911. The same thing can happen. The noise wakes you up and you have the emotion of joy, and that's what you're feeling because the thought that goes through your head is, my partner is home early from that business trip, and then you go in the other room and you embrace them. So it's important to note how tightly interlinked these all are, because it's not necessarily the stimulus that causes the emotion. It's the interpretation that we have of the situation that causes our emotions and then our behaviors. So this is not to say that every thought that goes through our head is unrealistic and doesn't make sense, and we should just discount them. That is not the goal of thinking about how we approach our thoughts. The goal is to think about, what evidence do we have for this interpretation or this appraisal of the situation? So first, we're going to talk about awareness of cognitions and mindfulness before we go through an exercise. So it can be difficult to even know what we're thinking. And mindfulness can be a way, mindfulness is often used, it's a great way to tap into understanding what our emotional experience is and to be able to respond to our emotions non-reactively. If you're interested in that, we talk a lot about that in our dealing with strong emotions, which is another one of these webinars that we'll be offering again soon. But mindfulness can also help us become aware of the cognitions that we're having. So a lot of times our cognitions just go underneath, just kind of underneath the radar. We're not aware that we're having these catastrophic cognitions and worried thoughts, that we're just having them as we're trying to go about our day. So mindfulness can be a powerful way to tap into those thoughts and really understand what it is we're truly thinking about. So we can try an exercise together. This is a little different than how we often do mindfulness, which is the mindfulness is about tapping into the physical sensations and trying to move away from our thoughts. But mindfulness can even be used to become better, more tapped into the thoughts that we're having. So if we all want to take a moment and try this exercise, just closing your eyes again, and then taking a couple of breaths and not trying to change them in any way. And we're going to first go ahead and tap into the experience of our breath. So noticing what your breath is like, where you feel it most strongly, and seeing if you notice it. Is it primarily in your abdomen? Do you maybe feel it in that little spot under your nose? Maybe you feel the cool of the air going in and the warmth going out. Just take a couple of breaths and see if you can notice what it feels like, the physical sensations of breathing. And now, if you take a moment to tap into what you're feeling in your body, noticing, do you feel like your heart is beating? Do you feel like your mind is full? Do you feel like you have a lot of tension in your body? Taking a moment to just notice how you're feeling in your body and getting really good and curious about it. What do you feel like right now? And then as you're doing this, see if you can just let whatever it is that you're feeling be okay. Not reacting to it or feeling like it should be anything different, just seeing if you can let it be okay. And then now, see if you can turn your focus to your thoughts. You're going to purposefully pay attention to them. You're going to really see if you can notice what are the thoughts you're having. And in a non-judgmental way, see if you can just see what's present, see what's there. Kind of go around in your mind. What are those thoughts that might be lurking around? And as you're breathing, you're not trying to change the thoughts. You're not trying to do anything to them. Just see if you can notice what's there. See if you can make some space for them to be present. And now on the next couple of breaths, focus back on your breath. And then whenever you're ready, open your eyes. All right, let's see. What did anybody notice about that experience? Was it difficult? Was it easy? Was it interesting? What were your experiences with actually focusing on and taking that moment to tap into the different parts of your experience?
Dr. Simon, I'm seeing here in the chat a comment about felt nice to check in and realize where my body was and where my mind was. So a good check-in with the body.
Awesome. Yeah, we don't check in with ourselves. We don't really spend much time being aware of what our actual experience is. Our minds are either in the past, thinking about things that have happened, or in the future, planning or worrying. We spend very little time tapping into the here and now and how we're feeling and what we're thinking. And this can be a powerful way of just bringing us back to this present moment and stilling the mind. And it doesn't mean that stilling the mind means you don't have any thoughts. Sometimes we are trying to do that. But it's also important to note that just increasing that awareness of what we're thinking is important. So we're going to talk about what we can do with those thoughts that came up. Did anybody care to share what was a thought that came up in your mind?
Dr. Simon, I've got a thought here that someone shared in the chat talking about um, their comment said, thinking back to the work that has been done or forthcoming work that they need to be doing.
Yeah, you're thinking about, you probably have some thoughts like, I have got a lot on my plate and I don't know if I'm going to get it all done, or how is this going to be impacting my work in the future? The thought might be a worried thought, just a questioning thought. And we can take those thoughts, and what we can do is we can evaluate them. So what we do as humans is we think our thoughts and then we take them as facts. We believe them hook, line, and sinker as if they're total facts, absolutely true. And we very seldom take the time to evaluate the evidence for or against that thought. And most of the time, there is no evidence for the thoughts that we have in our heads. But since we don't take the time to evaluate that, we don't necessarily know that. So, and this is important because specifically around worrying, I think worrying is a really big thing right now that we're all struggling with. Research shows that 85% of the things we worry about never come to pass, and that 15% that do come to pass, that we actually are able to cope with them much better, and we tend to cope with them in different ways than we were even thinking we were going to cope with them when we were worrying. So just knowing that we're far more resilient can be helpful, and that most worries and the thoughts that we're worried about, they just don't come to pass. So here's a thought experiment. Imagine you're walking down the hallway and you say hello to your coworker and they ignore you. What thoughts do you have? How does this make you feel? And how will you behave? So what thoughts would you have if this scenario happened to you? Anybody care to jump in?
I've got a comment here, Dr. Simon, saying feeling insulted.
Yeah. Yeah.
I've got another comment here saying that they would feel confused.
Mm-hmm. Yeah. And then the thoughts might be, what did I do wrong? That person is so rude. Different kinds of thoughts. And then how will you behave? You probably are, if you think that's so rude, you might decide I'm going to ignore them back. If you're worried about what you did, you might be trying to figure out a way to make amends. So it's going to be different depending on how you think about this situation. And then what if you were already in a bad mood? Then what? You're probably going to really think more likely like how the worst possible interpretation of the situation. So this is what ends up happening is we fall into thinking traps. And these are the very common ones that we have, especially when we're feeling worried and stressed. So there's thinking the worst or catastrophizing. This is thinking the absolute worst thing is going to happen, and then we overestimate the odds that it's going to happen, meaning in the moment it feels like it's 100% likely that the thing's going to happen, or that the thing is true, that my coworker is rude and is mad at me, or whatever it is that you're thinking. We jump to conclusions where we think we know what's going to happen or what's going on. There's black and white thinking. We think all one way or all the other, whereas most things are somewhere in the gray. There's emotional reasoning where we feel like we feel a certain way, and so we think the thought that's as associated must be true. There's fortune telling where we think we can predict the future, mind reading where we think we can predict what the other person is thinking, should statements. We spend a lot of time doing should statements, and it's important to differentiate between should statements like we should stay home, we should wash our hands, we should follow local practice guidelines or local safety guidelines. And that's different than should statements like I should be being a better parent, I should be able to handle this better, etc. And then there's also minimizing the positives. So thinking that when something really bad is happening, or we're really stressed, or we're worried about something that could happen, we minimize any positive aspects of our experience or what's happening around us. So now we're going to talk about cognitive challenging. And again, this isn't about saying that all of your thoughts are unrealistic. Right now, we are in a true stressful time where there is a real threat. There is some danger. So this isn't about positive thinking. This isn't about saying you shouldn't at all have the thoughts that you're thinking. And this is about coming up with a balanced thought that's based on the evidence. So the first step with cognitive challenging is to start with identifying what is the situation. We are all, we're sitting here, trying to do our best to work from home and parent our kids while there is this crisis that's happening, that's unfolding, and there's a lot of uncertainty. Those are facts. So it's all about just what the facts are. And then what are your emotions related to that? I'm feeling really distressed. I'm feeling sad. I'm feeling concerned. I'm feeling overwhelmed. And I'm feeling them really strongly. I'm feeling fear and anxiety, and they're all really strong. And then step 3 is, what thoughts are you having about the situation? So I'm thinking the very worst is going to happen. Me and my family, we're going to get sick. I'm not going to be able to weather this financially. And then what evidence is there that these thoughts are true? So picking a thought like we're all absolutely going to get sick, going and finding evidence for or against that. We haven't got sick yet. We are following the local guidelines that we're supposed to be following. The infection rates are low. We're in a non-vulnerable category. That's thoughts that they're false. So actually the thoughts that are true might be, well, maybe we are in a vulnerable category, or maybe we aren't following the proper guidelines. Maybe we're not even aware of what the guidelines are, so we haven't been following them. So that's what you're wanting to do, is figuring out what evidence do we have for or against, and then what other explanations might there be. So there's a low likelihood that we're going to get infected because we're following everything that we're supposed to be following and staying safe. And then what's a more balanced, realistic thought? And all of these steps you can go through, and it feels kind of step by step, but what you're doing is you're trying to pull all of the pieces of information you have together that you already know. And then when you have gaps, you're trying to find where you can find information to fill in those gaps. So going to the CDC website, looking at your local news station to see what they're recommending for what to do. This is an important part, because a lot of times we have these thoughts and if we don't gather the evidence and we don't have the evidence already, we need to find a way to get that evidence. And then once you have the evidence, you've weighed everything for or against, tapping back in with yourself and noticing how strong are your emotions now. Am I feeling quite as overwhelmed? Am I feeling quite as scared? And then am I having any new emotions? Maybe there's a little bit of relief. Maybe there's a little bit of a feeling of calmness. And then how might you behave differently now? What might you do differently? Maybe you're going to be able to engage better at work. Maybe you're going to be able to play with your kids now. So I want to stop there. I want to see if there are any questions about this process. Tim, I think you might be on mute.
Oh, there we go. Awesome. Awesome. All right, Dr. Simon, I do have one here, just discussing, talking about some days emotions are stronger, some days emotions are, it says one day I might have a strong emotion, the next day that emotion may not be as strong as it was the previous day.
Yes, I'm really impressed that you can tap into that experience, because a lot of times we don't have that. We feel a strong emotion. It feels like it's going to last forever. And then we just kind of don't notice that it went away. And I think that really actually speaks to, we don't have behaviors, we don't have emotions next, but we do have a slide on that. So what you're talking about is learning how to surf your emotions, to notice that one day you might have an emotion and the next day that you might not. Emotions wax and wane. They feel like they're going to last forever, but they don't. No feeling has ever lasted forever. So knowing that, and then working to do the best you can to ride the wave of the emotions as they come up, is a useful tool for not getting swept away by them. Again, if this is something you're interested in, we'll be offering a Dealing with Strong Emotions webinar either next week or possibly the week after. And it will be all about how to work with those difficult emotions as they arise, and not so that you don't feel like you get swept away by them. So that's a great point. I love that. So let's talk about behavior. So just like with cognitions, we can go in with our cognitions and we can evaluate information for or against it. The opposite, the other direction can also happen. So thoughts can follow behaviors as well. So when we are doing things that make us feel good, that can lead to more balanced thoughts, and our emotions can dampen, the difficult emotions can dampen as well. So right now it's important to do what we call behavioral activation. When we're feeling a lot overwhelmed by our thoughts, we can get to this place where we become less and less engaged and less active. But engaging in health behaviors can be really good for your mood. In fact, we know that one of the most potent things that we can do to address anxiety and depression is to exercise and do enjoyable activities. So go, have a virtual coffee date with your friends, exercise, watch movies with your friends. There's lots of cool like Netflix watch parties right now where you can actually chat with your friends and it's interactive and engaging. So that's pleasurable activities. The other way that we can feel better and deal with some of those thoughts that we're having is to actually do things like mastery activities. So we're not going to the office, probably to the post office right now, since we're sheltering in place. Maybe you can or you can't. It is an essential. I guess it is an essential business. So you could go to the post office as needed. But mastery activities are the activities that we do across our day that don't seem like a big deal, but they're ones that we can do and we can do easily. And by getting them done, they make us feel good. I don't know about you, but when I have a list of errands and I go and I deal with them and I successfully do them, it gives me a sense of accomplishment. And those, although they can seem really small and simple kinds of details, right now with how much uncertainty that we're experiencing, these kinds of mastery activities are going to give you just a little bit more of that feeling of control and calm during this time. So I'm going to pause for a moment there and just ask, are you engaging in some of those activities that are a part of your normal routine? And then how do you actually feel when you do them?
Dr. Simon, I've got a comment here talking about how in some places in the country, it's more difficult for ones to be going out exercising. That, and I've got a comment talking about how it's difficult to be interacting with friends if we're spending so much time on screens and then having to interact with friends on a screen again.
Agreed. Okay, I think these are two really great points. So the first one is that can be more difficult to exercise outside depending on what your local shelter in place and social distancing guidelines are. So I highly recommend that you follow them. It's really important. We're flattening the curve. Important to do that. And you might have to get a little creative about exercise. So what has delighted my soul is seeing that there are a lot of platforms right now, exercise platforms, apps and whatnot, that are either doing significantly reduced prices right now for memberships, or some of them are even waiving their fees to help people find some sort of at-home exercise routine that they can engage in. So I would highly recommend seeing if you can find some sort of exercise platform like that, and then engaging at home. And it really is important to be active physically. What's also important about physical activity and exercise is that it can help to boot us back from that stress response into the relaxation response. So exercising is beneficial that way as well for dampening down some of that activation you're probably feeling at the moment. And then for the person who was mentioning about screen time, it's been interesting to watch because at first it was like everybody was scrambling to be online. We need to feel connected. We need to see each other's faces. And then two things have happened with that. So one is it can be really dry and difficult to just sit and look at a person's face on the screen and just have a conversation without having sort of any activity. Most of the time when we're interacting with people, we're doing something. We're cooking dinner, we're having friends over for a movie, we're taking a walk, we're doing something. So I highly recommend making your social interactions as activity-based as possible. They'll still be virtual, but for example, and I cannot highly recommend this enough, it's actually fun. Cook dinner with your friends or family virtually. Set up your iPad or your Zoom call or whatever it is in your kitchen, and then you both cook. And what that does is it gives you this way where you're not just sitting here rooted to your chair looking at your screen. You can be referencing back and forth as you're looking at them, but you're doing something together that feels normal, and that normalcy can really help right now. And it gives you a more dynamic interaction. There's natural pauses when you're cooking. I have to focus over here as I'm chopping. You're dealing with something over there. It just makes the interaction feel more natural. So I do think making them activities based. And also right now, it's maybe just call up your friend on the phone, go for a walk outside if you can, safely following the proper distance requirements. Pick up your phone, put in your ear pods and go for a walk. Actually having that kind of interaction can still maintain that social connection, but you're not feeling like you're just glued to your screen. The other thing that can be helpful is some managers have been more understanding about how much there's this screen time fatigue. And so just seeing if your manager would be willing to have some of your work time meetings be over the phone. Even just having one or two less face-to-face meetings with you that are virtual can be helpful. So yeah, that's a really excellent point and something I think a lot of people are struggling with.
Dr. Simon, what about, I've got a comment here, what about learning a new activity? Because that can be distracting in a way and it's engaging our mind. Is learning a new activity or a new skill, would that be something that you would recommend that we do?
This is such a great question, and for two reasons. So the first one is that a lot of times when we're engaging in activities where we're trying to avoid our difficult thoughts or emotions, that can be problematic. If we're really not letting ourselves feel our feelings or think our thoughts and evaluating the utility of them, that can increase our stress and our distress. And right now we have this overwhelming stressful situation that have so many different kinds of stressful aspects to it. So if you are finding that taking some time to distract yourself from the stressful situation that's ongoing, and learning a new skill or learning to play a new instrument or learn a new language or whatnot, if you find that helps you to sort of disengage from feeling being in what I call the stew of stress, where you're just swimming in the stressful situation and you feel like you can't get out of it, it is totally okay to do something that's distracting to get you out of that stew of stress. That being said, I know there's been a lot of memes that have been going around, like if you haven't learned a new language or an instrument or some skill by the end of COVID, then you didn't do it right. If that doesn't feel right for you, ignore that. I know very few people who are actually being more productive right now. I know very few people who really can focus on something new and feel like they can actually learn that skill. So this is the kind of thing where if you feel like it's helpful, great, keep on doing it. If it's not helpful, don't do it. This is about you knowing yourself and what is going to help you get through this stressful situation. So yeah, those would be my two caveats. And I think that's a great question. All of these have been great questions and points. So thank you. And I love this. Keep on coming on. Any that come up, let me know. And then now going back to what we were talking about before about the emotions. So coping with intense emotions can feel difficult. And again, because it feels like intense emotions are never going to end. So changing your thoughts and behaviors will impact your emotions. Cognitive challenging can impact your emotions because it can help you feel like you have a more balanced, realistic thought that's happening, going through your mind. It can also help lead you to problem solving, and that's an important thing to note here as well. So when you challenge your cognitions, you think about what your thoughts are, you evaluate the evidence for it, and then if there are steps you can take, some actions you can take to make the situation better and to address the thought that's going through your mind, that's great. And then the other thing is that emotions aren't dangerous. They feel difficult to tolerate in the moment, and I don't really know very many of us that ever learned how to tolerate our difficult emotions effectively. That's not something we really learned in school. I don't know very many parents that teach it. So it can be tough to feel like we can just sit with our emotions, but they aren't dangerous. We can tolerate them. We can sit with them. We can allow them to be present and still focus on things that we need to do throughout our day. That being said, sometimes the emotions just are overwhelming, and especially right now where there are a lot of things that are happening. There's a grief response that's happening across the world. You're going to have some of these overwhelming emotions at times, and in those moments, it's important to know some of the relaxation strategies that can help you. So one of them was the deep breathing exercise that we did before, which is to slow down your breathing, bring it down into the abdomen, make it gentle, and extend those exhales. Another one is progressive muscle relaxation. So this is helpful because what it is it uses a tension relaxation technique to help you tap into where you're feeling tension in your body and then releasing it. You can either start on the top of your head or you can start with your feet. It doesn't really matter. It's really a personal preference. But what you want to do is you literally take your hands, if you're in your hands, and you tense them up really tight for a few seconds, and then you release. And then you're tapping into noticing how that feels differently between tense and relaxed. It can be really useful to do this when you're laying down. That can be easy when you're first starting to learn how to do progressive muscle relaxation. But at some point, you'll get to a point where you can do this sitting in your chair, when you're at your desk at work, and it's body part by body part. You're going to get really good and clear about where you carry tension in your body. And this will help you to release that tension. And again, this is a way to physiologically tap into that fight or flight stress response and help you to dampen some of that activation. Another one is guided imagery. So guided imagery is powerful because what you're doing is you're taking your mind to a peaceful place and you're incorporating all of your senses. So what do you see, smell, taste, touch, and hear? And how this works is it gives your mind another thing to focus on instead of thinking. And this can be useful, especially if you're having difficulties with sleep. So is anybody here having difficulties with sleep?
Dr. Simon, I've got a question on this slide right now, talking about using a language that is appropriate for children who are expressing our emotions to our children and doing it in an appropriate way that they can understand. Here, it sounds like we've got some parents who are trying to express their emotions, but also help their children identify these emotions. Could you speak to that?
That's a greet question. So with the emotions, part of this depends on what age they are. And I think we have a parenting webinar coming up soon. So definitely check in for that because we'll go in much more detail on this because it is really age related. I think as a general guidance, it's the more that you can be calm, kids pick up on our distress. So working on managing some of your stress through, attending some of these webinars can be helpful to learn strategies. And then on their level, asking them how they're feeling, not minimizing how they're feeling, validating their emotional experience, and then being just more general with the kids, especially smaller kids. They're feeling scared and worried, saying, you know what, this is a time where a lot of people are feeling some stress, and that's totally okay. And then validating their emotional experience, sharing just a little bit about that, you totally understand why, and then offering up the next step is really important. It's offering up what you're doing to help with what's going on. So validating that concern and then saying, this is why we're doing these different steps that we're taking. This is why we're washing our hands. This is why we're not having play dates. And at some point, we will be able to have those play dates. We will be able to go back to those normal things. And right now, this is what we're doing. You're helping and I'm helping to help ourselves stay safe and other people stay safe. So keeping it in that more sort of general sense of safety as opposed to taking a really deep dive into the nitty-gritty is important. And putting that into context. So helping them understand that at some point we will be on the other side of this. So those three pieces are all really important, so that their emotional experience isn't just, as I kind of put it, flapping around in the breeze. Kids need to know that that there is an end in sight, maybe not in sight for us, but that there will be an end to this, that we will get back to normal. And then trying to give them a little bit of sense of routine can be helpful for them to regulate their emotions. The more that their experience is just completely unregulated, or when there's no routine, even if it can feel kind of nice, they're getting lots of screen time, they're staying in their PJs, they're playing all the time, that can be important as well. But having regular meal times and getting them dressed for the day, even some of those tiny basics, and then interacting with them with their fun time, letting them pick what their fun is going to be, all of those things are going to give them a little bit more of a sense of control over what's happening, and that will all help them regulate their emotions more effectively. So does that answer that question? Anything further about that one? I think we could take a deep dive on this for sure.
Yes.
Okay, good.
Yes, did answer it.
Good. My heart goes out to everyone who is parenting right now. It's that you have basically an impossible task, and you are navigating it. And I want to just say that, like, you are navigating it. You are making it through. Be as kind and gentle with yourself. You do not have to be super parent. Give your kids the basics, give them a little bit of structure to their day, and be gentle with yourself, and know that you are doing the best you can. So is there any other questions? We have a couple of minutes. Any other questions about anything we've talked about, or anything that you'd like me to answer?
Dr. Simon, I've got a question about timeline for dealing with some of these emotions. And is it typical for these emotions to last to last longer than usual given our current situation?
I think that's fair. You are going to feel distressed. You are going to feel, it's going to probably be impossible to just feel totally normal and happy, because there is so much going on. So riding that wave of the emotion, tapping into it, letting it be present when it is present, validating that emotional experience, making sure you're doing those pieces, that will be important, because when we resist our emotions, we give them power. So kind of to answer this is, I do think that part of our elongated emotional distress that we're experiencing right now is normal. And part of it might be if you are keeping excessively busy, if you are using substances, or if you're doing things to numb out of those experiences or just avoid feeling them, that will prolong them as well. So step one would be to just tap into what you're feeling, see if you're trying really hard to resist what you're feeling or push it away. And if that is the case, take some time to sit with the emotion and let it be present, using that mindfulness, the mindfulness skill of paying attention to your emotion on purpose without judgment, seeing if you can sit with it for a few minutes and notice it from a place of curiosity, whether it's waxing and waning. That will be an important, that'll be an important step, just to make sure that you're not prolonging it because of avoidance. And then if you're not, just being okay with the fact, just accepting that right now, you're going to feel more emotionally distressed. So that was a good question.
And Dr. Simon, I've got a question here referring back to the example of you saying hello to a coworker and they ignore you. And our comment here says, sometimes I feel like I'm that coworker who does the ignoring. I don't want to be bothered by my colleagues that I'm still working with, or I don't want to be bothered by my family members. And I feel bad that that's the way I'm coming off.
Totally get it. Totally get it. Right now, we either have a lot of aloneness or a lot of togetherness. And the people who are in each of those groups have different kinds of issues that they're dealing with. If you're dealing with a lot of togetherness where you just don't have any time to think your own thoughts, that's problematic. We all need our space. We all need together time, and we all need alone time. So first, step one, that's okay. Step two, I highly recommend having a direct conversation. It's something we don't really almost ever do, but it's really effective. Telling your coworkers right now you're feeling really overwhelmed, and right, that because of that, one of the strategies you're using to help regulate your own emotional experience is to try and just lessen some of the interaction time that you're having with people because you're feeling overwhelmed with Zoom calls or whatever. Just letting them know, just telling them what's going on. They're probably going to be pretty understanding, and in fact, some of them might be relieved because they might be feeling the exact same way. And the same thing with your loved ones, asking to see, having that direct conversation. Can we come up with a plan where we each get to have our time together that's purposeful, and then we all get to each have our time separate where we can just kind of relax and decompress on our own? Can we come up with a plan? Having a direct conversation that concretely leads to a plan will reduce some of that awkwardness. It's a great question. I've loved every question. They've been wonderful. And I think we're right just about at time. So I'm going to put it to here. If there's anything else, or Tim, if you want to wrap us up.
Sure. Again, if questions are still trickling in, please feel free to pose them either through the chat or the question and answer feature there as we are wrapping up. And so thank you so much for joining us and for sharing your thoughts and sharing your wonders with us as we're working through this together. We're so thankful to have Dr. Simon with us. We invite you, if you'd like, to download the app, Modern Health app, on Google Play or on Apple, and to get started with your Modern Health benefit. If maybe your company already is working with Modern Health. If you have any questions, feel free to reach out. If you are working with Modern Health, feel free to reach out to your coach. And they can better support you and provide additional resources for you. Or if you'd like to reach out to your HR representative, do that as well, because they may also be able to point you in the right direction. Also, if you do still have questions, feel free to reach out to Modern Health at help@joinmodernhealth.com, regardless of if your company is already working with Modern Health or this is your first time with Modern Health. Please feel free to reach out. We're open to taking questions and providing support as needed. Again, this session is going to be sent out to everyone at the conclusion. We are so thankful that you were able to join us today, and thank you, Dr. Simon, for being with us and helping to answer those questions.
Thank you so much, everyone. I hope you can find some moments of peace and joy across your day.
All right, everyone.